So welcome everyone to the very last morning of what has been an absolutely full week of the Combined Regenerative Medicine Essentials course and the World Stem Cell Summit. So what we have in the room are the folks that are really interested or catching a late flight or otherwise want to get a free breakfast. You never know who's in the room in the end, but the way I look at it as the person that largely conceptualized the World Stem Cell Summit is if I have a lot of smart people in the room and they're not going to leave town yet, I want to squeeze every bit of content that we can for those that are interested. And of course, the folks that are here are the live studio audience for a broadcast later that's going to be seen by many, many interested people on YouTube. They might not be looking at me, they'll be looking at all the brilliant people that we have invited. I want to say first, this is an opportunity for me to give a thank you to the wonderful staff of the Regenerative Medicine Foundation. And that includes Kevin McMahon, who is our wonderful producer, web developer, and graphic designer. Joey Dawson, our director of communications, that has expanded our social media tremendously in the field. I want to thank Jerry Friends, who hasn't been able to come with us, our CFO that keeps me out of trouble. All of these wonderful people have helped us. Also, an incredible work by my colleague Melissa King, who is the COO of the Healthspan Action Coalition. Yes, she's getting a round of applause, who working way below her capacity actually arranged for a lot of the hotel rooms that needed to be covered and organized and did a lot of things that otherwise would have been a real struggle. Everyone stepped up. Someone who couldn't attend but has been in the background of helping organize everything is Eve Harold. Eve Harold is the Director of Public Policy Research for the Healthspan Action Coalition and my longtime colleague, and one time was essentially the Associate Director of the Genetics Policy Institute. So Eve also helped us as well, and the entire staff and support of both organizations are so appreciated for all their hard work. Of course, I have to also give a shout out to Dr. Anthony Tony Atala, who one of my co-chairs in the Regenerative Medicine Essentials course, and also Joan Schenk, who is the Director of Education at Wake Forest Institute for Regenerative Medicine. So I hope you're at least all well fed in the room. There's an abundance of Mrs. Pumpkin's good food still left over in case you want to take some grits home with you wherever you're flying later today. So my name is Bernard Siegel. I'm the Executive Director of the Regenerative Medicine Foundation and also the Executive Director of the Healthspan Action Coalition. And what has been built is a history of patient advocacy, and is on the slide, Healthspan Advocacy, a new global movement. I'm going to talk to you a little bit about my personal journey on getting this, why I'm here today, and also beyond the personal journey, discuss with you in general patient advocacy and how the patient movement has moved the regulatory needle, and give you an overview and hopefully some context on how the world works. I want to welcome any of the students that are here that could be doing something else now but have chosen to attend these last sessions of the World Stem Cell Summit. So there's a picture of me, right? I was giving a lecture in Buenos Aires in the Congress building a few years ago. It made me feel very important because they were translating it. And the subject matter were stem cell clinics that were emerging in South America and Argentina that actually were selling things like apple stem cells and things that weren't really tested or real. But stem cells almost have become a commodity, right? Everyone is using stem cells. Well, stem cells have a long story, and so does patient advocacy. So first, let's just put a little in context of the history of patient advocacy. Now, if you're as old as I am, and was a little boy in the 1950s, and I was in elementary school in Richmond, Virginia, we used to get a little card placed on our desk, and every week we would put a dime in a little slot in the card, and that was called the March of Dimes. And the March of Dimes was an advocacy movement created in the United States because at that time there was a dreadful disease, polio. And my wife Cheryl has a cousin that was afflicted by polio and requires her entire adult life walking with a cane. There were children in an iron lung, and it seemed to strike at random, and it was terrifying for all of our parents of my generation at that time. Well, Jonas Salk, a tremendous, great scientist, came up with a vaccine. Now, the scourge of polio reached back to our President Franklin Delano Roosevelt, our president during World War II. He was stricken by polio. He had to get around in a wheelchair, but at the time when there wasn't television, he would manage to get around, but the news reporters and people close realized that he had a problem, but he managed to struggle through it and was one of our greatest presidents. So thinking about President Roosevelt in the 40s, thinking about what was going on and the fear for the children, there was launched a vaccine, and it was really, I would frame it as a clinical trial, where all the parents in the United States volunteered their children to get a shot or later on a sugar cube with medicine in it. And what it did, it inoculated my generation and future generations from polio disease. But that was, how did that come about? The March of Dimes was a movement to press that forward. Let's look at cancer, and you see this image of a postage stamp with Mary Lasker. And Mary Lasker said, "I am opposed to heart attacks and cancer and strokes in a way that I am opposed to sin." Well, Mary lost her mother to a terrible illness. She lost other family members to this. It impacted her life severely. Now, Mary was a go-getter, and she married a top advertising agency executive in the United States, and through her efforts and enthusiasm, managed to grow the American Cancer Society into an enormous enterprise that has changed the world of cancer and has become, and was at the time, a major medical philanthropy. She popularized, through her efforts, the force of advertising, communications, patient suffering. Now, this tale is embedded in Sid Mukherjee's award-winning book, Cancer, the Emperor of All Maladies. And you understand the scourge of cancer. And there was a time when a patient got that diagnosis that it meant the end. It meant the end. It meant suffering. You might be able to alleviate some pain. Skipping to my personal story, at age 48, I knew something was a little wrong with me. And I was a little embarrassed about it. But I talked to my wife, and she said, "Well, just go see the doctor." So I saw the doctor, and they took a blood test and an examination. And a week later, I'm in my law office, and they call up, and they say, "Bernie, you have to go to the doctor. You know, doctor wants to see you." No one wants to get a call like that. And you go to the doctor, and you sit there, and I said, "Bernie, I have bad news. You have colon cancer." Okay? You know, listen, I was active, children going to college, a child going to college. It was a big, big thing to hear. And a tear welled up in my eye. And the doctor was actually surprised. And I said, I can't believe I'm only 48 years old. And he says, well, you know, this is treatable, Bernie, and this is what you're going to do. You're going to have surgery, and we're going to find out what this tumor is, and you might have some chemotherapy, or you might have some radiation. So for 1 year of my life, when I was in the prime of my law practice, it was a challenging year. But I've not had a reoccurrence since, and I owe my life to the pioneers of medicine and funding medical research so that there was a treatment for cancer at that time. Mary Lasker, for which the Lasker Award, a major prize in medicine, is named, was a mover that made cancer be looked at in a different way, that we can find a way to treat. And the barbaric way it was treated is something for the history books that you can read yourselves. But more and more sophisticated treatments there are here. Now we have immunotherapy. And we have the story of people like Emily Whitehead, who you may have heard of, the young girl that basically with immunotherapy was cured of childhood cancer and survives today and is a beautiful college student, right? So this didn't come out of thin air. It came out of a movement. Now, here's a portrait on a postage stamp of Frederick Douglass. Power concedes nothing without a demand. It never did, and it never will. So we have the growth of a movement for cancer, and there have been many public initiatives. We honored in a Stem Cell Action Award a few years ago, then former Vice President Joe Biden and Dr. Jill Biden for the Cancer Initiative, all right? Prior to that, President Nixon had a major Cure Cancer initiative that rallied public support. We still haven't cured this terrible affliction, but we're on our way to doing it. But the theme of this stamp that I'm showing you is how the needle is moved. So we're going to jump ahead in time to talk about a couple other advocacy movements. We're going to talk about women's health, and we're going to talk about the AIDS HIV pandemic, epidemic. So when we look at, let's look at AIDS HIV. The FDA, the Food and Drug Administration, is the most underfunded agency for the importance that it has on human health in the United States. It's absolutely extraordinary because the burden on the Food and Drug Administration is to make sure the medicine we take is safe and effective. And through that, there is, clinical trials and burdens and hurdles that any entrepreneur, a pharmaceutical company, a biotechnology company, before this medicine or a cell therapy company can get into people, it has to be shown to be safe. Clinical trials, usually animal testing, although now we've learned in this meeting there's precision-free animal testing, maybe a better and streamlined way for some of these therapies to go forward. We have to have an effectiveness study. Is this going to work? There's another phase trial, 3 phases to go through. And many diseases or many trials fail. Most of the trials fail. And if we remember that we honored Taylor's tale about the little girl with Batten's disease and her family in the public day, they were going through a stem cell clinical trial, and she was lucky enough to be a part of the earliest little Taylor of the first clinical trial. The very first, is it safe or not safe? But her health improved in an extraordinary way. That was fantastic, but the company ran out of money. So the technology that might have been able to be curative of this rare disease could not move forward. It's the system that we have. Some of you were in the room yesterday, some of the students listening about the world of business and startup companies, and it was like a big light bulb went off when you realized that there's a whole nother world out there of how the research that they have as young scientists are actually going to bear fruit for human consumption. But getting back to the AIDS HIV movement, it was an illness and the finger was pointed at the gay community, largely gay men. And it was not treatable, and it was horrible. And there was prejudice against the community. It was scary. The president at the time, Ronald Reagan, didn't even want to talk about it. It was something that was almost forbidden. The system was not created in an emergency situation to accelerate approvals, to recognize the emergency for what it is. But a brilliant infectious disease scientist by the name of Anthony Fauci from the federal government at the time met with the leaders of the gay community and who were on the street protesting. The families that were afflicted with this, not necessarily just gay men, but the broader community, were protesting. There were sit-ins, there were arguments, there was noise. They pushed so hard that they moved the regulatory needle. They actually moved the regulatory needle. And now we have a treatable medical condition rather than the scourge of a death sentence there. When you think about women's health that was underfunded and remains underfunded for decades, think about the breast cancer movement. Why do we all wear pink ribbons? Why does the NFL and other major companies adopt this breast cancer movement? Women's health has become an issue. It wasn't from sitting silently, it was by making a demand. Effective advocacy isn't more just raising your hand and say, I want something. It requires an effort. And it's through the power of the patients that move regulatory systems and political systems around the world to move this field forward. Lincoln said in one of the Lincoln-Douglas debates, public sentiment is everything. With public sentiment, nothing can fail. Without it, nothing can succeed. Now, what does that mean? What does that mean to you in this audience when you think about it? Because where we have battles like we've had over COVID and COVID vaccine, or we have people that look at public health as an affront to their own freedom, but in a public health emergency, at what point is there a duty of citizens to step up? In a world where there's a lot of darkness when it comes to science, the people in this room and are listening to this are the candle. You're the candle. You're the light. So in my own advocacy over these last 20 years, we come to the world of stem cells and regenerative medicine. Remembering what happened with my own experience and my own illness, and everyone in this room has been impacted in some way with a loss, an illness of not to themselves, to loved ones. We know that, and the incurable diseases. When the field of stem cells came to the public attention, and that embryonic stem cells in the late 90s with researchers like Jamie Thompson in Wisconsin, and fetal stem cells with John Gerhardt, who is then at Johns Hopkins, and pioneering scientists, and Dolly the sheep, and being able to reprogram cells, and Dr. Sir Ian Wilmot in Edinburgh. This captured the public's imagination. It captured the public's imagination, especially embryonic stem cell research, which means that we can take cells from an embryo that would created from IVF that otherwise would be discarded as medical waste, and the parents, the owners of those cells, could donate them to science, but that became very controversial. In the context of the United States, what that meant is that it was hijacked, so to speak, into the ongoing abortion debate. Because if you look at those cells as people, were they people, even though they were a microscopic dot and they weren't implanted in a womb? Who owned the cells? Does the government have a right to say we are going to force those cells to go into a womb to be a baby? But that's the fight that was going on then, right? Yet these cells, when you think could be transformed into any type of organ in the human body, the potential, the forces, Mike West in The Immortal Cell wrote, it was like nuclear fission in a petri dish when he looked at the first embryonic stem cells in Jamie Thompson's lab, okay? But this was controversial 20 years ago. Moreover, there was a way of cloning one's cells called somatic cell nuclear transfer. Well, what was that? What that meant is that we could take one of Melissa's skin cells, 37 trillion cells in your body, a little skin cell that would be born a skin cell, would die a skin cell, but it could be transformed by putting it into an egg with its nucleus removed, and it would be transformed into an embryonic cell, matching Melissa's DNA. So it was viewed as a tool at the time, yet in the debate at the time, it was called human cloning, which was a sledgehammer term, And lawmakers, largely social conservative lawmakers, were creating laws to ban embryonic stem cell research, to ban somatic cell nuclear transfer, to put scientists and even patients who availed themselves of this into jail. All right, think about that. That was 20 years ago. And human cloning, that this was going to be, Brave New World, was believed to be around the corner. So in that hysteria at the time, taking it to my own personal story, a group claimed that they cloned a baby back in December 2002, and they made the announcement in Florida. And being the creative lawyer that I was, and knowing that this group had appeared before Congress and the National Academy of Sciences, and were in effect panicking the public that human cloning was around the corner because they professed they were going to do that, they announced that they had cloned the first baby. They made the announcement in Broward County, Florida. Now, a more amusing version of this story exists on a TEDx talk I gave, but I'm going to get to the heart of the matter. I sued this group, and anyone who's aware of an exploited child, and they weren't doing the DNA tests that they promised the world. They made the announcement in Florida. They didn't produce the baby. I sensed, and a lot of people sensed, that this worldwide news story as the first human clone might be fake. So I filed a motion for temporary guardian for the alleged cloned child. To me, it was the logical thing to do. And I did it on my own behalf as an officer of the court, anyone who's aware of a neglected or a child that could be exploited. And as fate would have it, I served papers on this company Clonaid that was part of a UFO cult called the Ryalian Movement. I know this sounds a little strange to you, but it turned into a worldwide cause celeb. And in the course of 1 month, I was able to effectively show that Clonaid and these people were a sham. And it was a sensational story around the world. And a court case that played out on world television with the President of the United States, George W. Bush, in the State of the Union address the night before the hearing, decried human cloning. That's how serious this was taken at the time. And it was derailed. Now, do we worry about cloning today, even though we have cloned monkeys? Not so much. It's in the background. And we don't really need somatic cell nuclear transfer, because you heard about Yamanaka and cell reprogramming with viral vectors that have been discussed, iPS cells, induced pluripotent cells. But at the time, the crushing opposition to stem cell research gave birth to a movement of people that said, this is going to impact my life, my loved ones, and all of a sudden a public that doesn't know about the National Institutes of Health or the Food and Drug Administration, but saw this as a personal health issue. It became a consumer health issue. And what I did was I was invited to the first meeting of the stem cell scientists, the ISSCR, and the scientists reached out to me and said, Bernie, you're the only person that filed this case. You protected science. Thank you. And they convinced me to, and I left my practice of law, still with a kid in college, and decided to create a nonprofit organization to advance the field of stem cell research. Because when I went to that meeting that starts next week, I'm a member of the ISSCR today. It's a fabulous society. But at that meeting of 650 scientists, the inaugural meeting in 2003, there were no members of the public there. I was like the only patient advocate. Now, I've done some public relation projects and I've sports-related projects in entrepreneurial things as well as practice law. And I had a way of knowing how to promote things. And I wasn't afraid to debate someone on the television related to the issues of cloning or to help organize a movement. So very early on, a movement was created. We're thinking of the polio movement, thinking about the AIDS, HIV movement, the cancer movement, thinking about the movements in the past. This was no different than anyone else. But what was interesting about this, it covered the whole gamut of illness and patients, whether it was sickle cell or cancer or heart failure. Stem cell research was a universal type of research and a brand new field of medicine. Think about cell therapies as a silo. Think about it as a column. We have a Greek temple, right? The roof of the temple is healthcare and Healthspan, a healthy lifespan. That's the roof. We have one pillar, pharmaceuticals, a pillar called biologics, a pillar called medical devices, and this little pillar that isn't reached the top called cell therapies. Nothing is reimbursed by insurance. The FDA is putting it through a process largely the same as if it's a big pharmaceutical. But how are you going to track a patient over years? How many years are we going to have to wait 30 years or cure a mouse of diabetes? It's going to take 30 years to use a cell therapy for a person. Whose ox is being gored? Who in industry views this as something to resist? This wasn't an easy movement. And where states started to ban it, other states started to create citizens' movements to advance this. So at the same time that I created the Genetics Policy Institute that is now the Regenerative Medicine Foundation, out in California, a Stanford-educated attorney and public bond expert by the name of Bob Klein, who had a child with diabetes, type 1 diabetes, and this gentleman was very active in the diabetes community and the JDRF, was a spark plug behind something absolutely incredible, a bond initiative to raise $3 billion to create the California Institute for Regenerative Medicine. Why? Because the NIH wasn't funding this field at the time. It was too controversial. The narrowness of what President Bush at the time had approved were just a set of stem cell lines, embryonic stem cell lines that had been created earlier, that were mostly created out of mouse cells or embedded in mouse cells that weren't ready for prime time for human transplant. But no federal money could go to any development of new stem cell lines. And laboratories had to set up a yellow rope, you know, between what was federally funded in stem cell research and what wasn't. And none of the money that was going for embryonic stem cell research paid by outside philanthropy or the institutions, you couldn't use a pipette over there, over here in your NIH-supported labs studying and everything else. It was incredibly complex. Well, Bob Klein and Melissa King, who's here, who is now the Chief Operating Officer and co-founder with myself and patient advocate Sabrina Cohen of the Healthspan Action Coalition. Melissa became the first executive director of the California Institute for Regenerative Medicine, managing their board of, you know, an impossible number of about 30 top people at the universities throughout California. She was also the head of field operations of Prop 14 in 2020 that raised another $5 billion. All right, consider $10 to $15 billion of taxpayer money for an institute for regenerative medicine in California, filling a giant unmet need and fueling a whole industry there. It came from thousands of ballot measures. Melissa was the head of field operations of that campaign, and I was lucky enough to be a member of a 4-member board of directors of that campaign. All right? What drove that campaign was patient advocacy. People like Adrian Shapiro, our sickle cell and stem cell advocate in California. It covered the state. It advertised, and even though they tried to oppose it, it cemented in the Constitution of California this agency, as stem cell research was cemented in, of all places, Missouri and Michigan and other states that were trying to shut it down. So this movement that you see, and if you've attended the World Stem Cell Summit over the course of 20 editions that we've had, what you will find is the core of our meeting are the patient advocates. The things that were missing from the ISSCR are the people that we embrace, because I consider myself a patient advocate, and all of these groups need to have a seat at the table. Pharmaceutical companies love patient advocates. They're there, they support it. The biotech industry loves patient advocates. But who has the voice? How do you empower patient advocates to know the things and the tools necessary so their voice is heard in Washington? And it's not just in Washington, it's an international issue as well. I'm going to show you this slide so you can sort of understand the ecosystem in which we operate. How am I on time, by the way? Good. All right. So, I use this slide for a lot of different purposes. I was invited to join a workforce development task force of Innovate Bio, and this was in Madison a few years ago. And Josh Hunsberger wrote me into it, Joan. You can appreciate that. So I go up there, and he says, you're going to be the opening keynote address for all of these institutions that are trying to create workforce development for cell and gene therapies and cell manufacturing, because it's an unmet need. Okay, so all of our community colleges like Forsyth that are training with great technical programs are generally underrepresented. Yet there's a community college in every congressional district, and many of them have biotech programs for technicians. So how are we going to train those people? So I didn't know what to say. I'm not an expert in any of this, but it never stopped me before, so I decided I'll tell them what I know. So I created this slide with workforce development in the center for the regenerative medicine and cell manufacturing field. But this is my own design of an infographic, as made, of course, by Kevin McMahon, our graphic designer, into something that's reasonably useful. And if we look at our field in the middle and think about this in this audience where you fit in, just think about it. And we have cell manufacturing and the organizations. You learned about contract development organizations and funders like the Marcus Institute and REMDU that's here. We learned so much in biofab. And each of these represent, in some cases, hundreds of organizations. Cell manufacturing, industry, biotech, and pharma. We had a great presentation on startup companies that some of our students attended to open up that curtain to think about, the budding entrepreneurs. And the role of each of these organizations and the communities around them. Workforce development, facilities such as Innovate Bio, philanthropic effort, which are massive, investors, disease advocacy groups. Put a star now, if you've attended this meeting, you'll put a star next to that one. Ethics, law firms and consultancies, insurance and reimbursement. If we are all going to live another 50 years and 150, some of you in this audience are going to live to 150, believe it or not. Right, Aubrey? Yes, sir. So, how's the insurance industry going to deal with this? Societal institutions, transhumanist, the Vatican, futurist, organizations like that, government, not only in the United States but internationally. This is a geopolitical issue. Media, scientific journals, of which there are hundreds if not thousands. Human rights. The first campaign that our organization worked on in 2004 was in the United Nations. My first conference I organized was for the United Nations on human cloning in all its aspects in the Dag Hammarskjöld Auditorium in the United Nations, where we derailed a world treaty that the United States government was backing that was going to ban somatic cell nuclear transfer. It was hijacked into human cloning, but really it was aimed at embryonic stem cell research, and it was derailed in the legal committee by a single vote by patient advocates. That's really where I would say I earned my stripes. If I did nothing else in my career, that I was able to be a leader in that campaign, basically of the organizer of the movement, and held 2 meetings in the United Nations, including a video with Christopher Reeve before he died, which I was able to go to Christopher Reeve's house in New Bedford and film that. It was probably the most amazing moment in my life, other than getting the award from moms at this event. Conferences, oh boy. For anyone who's not familiar with conferences, show up. Someone said 80% of success is showing up. Show up at the conferences. You can be a student, you don't feel you know anyone, you're not going to ask a question. A student came to me this morning, I won't identify him, I had a nice chat with him and I appreciated it. I learned about his education and his goals. Show up, man, networking is the name of the game. Scientific societies, medical specialty, regenerative medicine, clinicians, societies, a whole emerging field of regionology, and the father of regionology as a medical discipline is none other than Anthony Atala. Soon, every medical school in the country will have a department of regionology. Academic institutions and hospitals. Do you understand now, not only this is the United States, but the entire world? And how are we going to deliver this? That's a good question. Let's see. Oop. So, as my final slide, I want to show you the next evolution of advocacy. The next evolution, I submit, is a group called the Healthspan Action Coalition. So Melissa King and I, Melissa from her vast network of organizing patient groups for the campaigns in the California Institute for Regenerative Medicine, knows how the system works. Through a history of speaking around the world on patient advocacy and stem cells, and organizing meetings like the one that you've attended, I have had the good fortune in my organization of building an incredible network of contacts and professional friends and colleagues. It's not enough that we just cure a disease or find an effective treatment, but we understand it's not just prolonging the chronological age of people. Now we can actually create a healthy lifespan for people. So it wasn't just Melissa and I. I called a dear friend who had been my first associate director of the Genetics Policy Institute, a young woman that I had met at the Miami Project to Cure Paralysis, way back circa 2004. Her name was Sabrina Cohen, who had been rendered a quadriplegic in an automobile accident. It wasn't her fault. She was wearing a seatbelt. It's a terrible accident. She was in the back seat. The boys decided to go drag racing. She made one mistake on a Halloween night. She was the good, perfect child, but these boys invited her to go out in their BMW, and they decided to go drag racing, and she was the one that was hurt. Now, Sabrina's a special person. She was the person of the year of Coldwell Banker Realtor. She's had a fabulous professional year, and she has the Sabrina Cohen Foundation, which has adaptive beach days in making beaches in the Miami Beach and around the country accessible to folks with disabilities, as well as other advocacy for stem cells. She received a National Advocacy Award from the Regenerative Medicine Foundation. But Sabrina, unfortunately, is a quadriplegic. And I asked her, Sabrina, Melissa and I are going to create a foundation related to a healthy lifespan. And I want to understand from the SCI community, the spinal cord injury community, what you think about this. Is this meritorious? And she said, oh gosh, Bernie, this is so timely, because in my community, of all of us that are in wheelchairs, we don't look at ourselves as having a long life. Our chances of living a long life and a healthy life are curbed and serious. I'm surprised I am as old as I am. And Sabrina is fortunate because she is able to have the resources and care. But as we heard from our friends in the Ring of Brotherhood, where we received a recognition at this meeting on the public day, where sisters are the caregivers of an injured professional boxer who for 20 years is not functioning because of a brain injury. Those people did not have resources. They had love and sacrifice. Now let's go into the emerging world, the emerging economy, the third world or the developing world, where there's grinding poverty. How are the things that are going to be moving a healthy lifespan going to impact them? There's an unmet need for health equity and distributive justice. There's an unmet need for renovating our regulatory systems around the world to keep up with innovation, to have reimbursement for workforce development, for getting the word out, for harnessing the energy of the longevity movement, meritorious movements supporting things like Altos Labs, using iPSCs to be able to prolong human life. But that isn't just for the longevity enthusiasts. That isn't just for the select few. How are these things going to be moving forward? So I submit to you that what was needed was a way to unify not only the patient advocacy movements and academic institutions around the world towards this, but also other nonprofit organizations that are supporting things like animal-free precision medicine. There are workforce development in the field. If we can grow those, and give a seat at the table. So in a period of less than 6 months, we have created 71 organizations, or 72 by the end of this meeting, organization covering the gamut of patient advocacy and afflictions. If you are aware of a nonprofit organization, a scientific society, a meritorious club that has a website, it's not a business, although we will eventually, I'm sure, get business support. There's no cost to joining this cause. You just go to healthspanaction.org. You communicate with Melissa, with Eve Harold, and others that are involved, and become involved. Why? Because you're going to have a seat at the table. You're going to have access to webinars. You're going to have access to a community that otherwise might have been alien. If you have diabetes, if one has diabetes, it doesn't mean you don't care about someone that has Parkinson's. It doesn't mean you don't care about someone that has sickle cell. We're all in this together, and this is the key. Together, we can make the demands, because power cedes nothing without a demand. The demands are going to be coming, and we are all in this together. And our goal is that all of our friends, our loved ones, and ourselves, everyone has a chance to have a healthy lifespan. It's a universal. No matter what you belong to, what tribe, what religion, everyone universally believes in healing. They believe it. They might not like the person across the street so much and not care about, but in principle, we all believe in healing. So I think I'll end that and take a few questions before 10 o'clock if we're not there already. We're at 10 o'clock. I'll take a few questions.
Bernie, great talk. Really great talk. A few days ago, Tony Atala spoke about an array of stem cells and the need, in terms of regenerative medicine, to specify what kind of stem cell would be ideal for a given patient. So you highlighted, I think, several areas of advocacy. So what's the analogy? What's the mirror image there between selecting stem cells for a patient and selecting a particular advocacy tool for a particular advocacy problem?
Well, I must say the person that asked that question is my dear colleague, Alan Giacomo, who is a fellow of the Regenerative Medicine Foundation and one of the founders, and also affiliated essentially as a fellow of the, for AI, amongst other issues, for the Healthspan Action Coalition. He was the co-author of a book chapter that we wrote. And by the way, pay attention to this. If anyone asks you to write a book chapter, forget it. Write a book. Because the amount of work that it took to write a book chapter is a lot of work. But anyway, it was on it was on the role of patient advocates and the public on the regulation of regenerative medicine. And there are tools in the toolkit. You're asking about the tools, and you're thinking that my memory serves me, that I remember all the tools of the toolkit. I have it in my notebook. But the tools in the toolkit include communications. Communications. How are you going to communicate the expertise? How are you going to communicate the message to the public? Media. How are you going to work with the media? Collaboration. There are all sorts of collaborations, and that's the hallmark of this. Alan, help me out here because my brain cells are exhausted now. Tell us some of the other tools in the toolkit.
So
I didn't get enough bacon and eggs this morning, so I'm fading.
I think the way to answer that would be the 6 examples that were given, the 6 case studies. So it may make more sense to go through
Remind me what the 6 case studies were, Alan.
So you spoke about one of them here, which was the Ryalians and Eve.
The cloning case, right, baby
case.
Eve.
Then Prop 71. And Prop 71 was about legislation. So Eve was litigation. Prop 71 was legislation, and Bob Klein's brilliance, and as you said, Melissa just played such an important role there. And then in terms of regenerative medicine and stem cell treatment, we covered the use of not CAR T cells, but the programming of dendritic cells to hit a particular cancer. And that was more of, and there the focus, if I'm remembering correctly, was the role that patients played at the FDA Advisory Committee.
Right. The role of patients in the FDA.
Yes.
And the advisory committee, and the opportunities for patients to give testimony.
And then one of the highlights, and you don't talk about this very much, but the Friends of the Court brief before the Supreme Court. So you may want to
Well,
talk
right,
about that.
right. So we had the opportunity to submit a brief to the Supreme Court, the Court of Appeals and the Supreme Court, over the rules and guidelines that the Obama administration had for progressing embryonic stem cell research. The opponents for that were trying to knock that out. So basically, we would not be able to have federally funded embryonic stem cell research. By being able to file our own brief and get permission as an advocate, as an advocacy organization, it was one of my greatest privileges, because I have no longer, even though I'm a retired lawyer, I still a member of the Florida Bar. The last legal document of a court case that I signed was an amicus brief to the United States Supreme Court on behalf of the Genetics Policy Institute, the predecessor to the Regenerative Medicine Foundation. And in this case, the FDA prevailed in this, which was good for stem cell research. By the way, I don't know whether the outcome would be the same with the way the Supreme Court is constituted now, but that'll be another issue.
Interesting question. But I think it's important to highlight that where you began with the Raelians in a state court in Florida, depending upon, if I remember correctly, what you remembered about studying Dolly the sheep.
Yes.
With Lisa.
Yeah. So, all right. Alan's trying to drag out of me the whole story. And I'm going to say this: the reason I was interested in stem cells, because my daughter Lisa was doing a paper on Dolly the sheep. I think she was in middle school, and I thought it was such a cool topic. I read the encyclopedia entry about John Gurdon and the cloning of frogs, and it was of topical interest to me. So when they cloned the first baby, I said, well, I know something about cloning. I read that middle school paper, so of course I'll sue them.
Bernie, sorry, it's very sensitive, Mike. Sorry about that. It was great to hear the full story, because I've got to know you and Melissa a little bit, but hearing it all outlined right now was excellent for me. I guess my question is very succinct. Now that this coalition has been built and you have these stakeholders, have you picked an initial initiative? Because you talked about all the other things that were done in the previous project, but now that we're here, now in this era with Healthspan and longevity sort of becoming the new goal, the new mission with this new agency or coalition, have you picked an initiative, whether it's political or legal or anything that you think is sort of like the first step to move towards?
This is a really broad movement. It's a great question. It's a great question. So this is a huge movement, and it's global, all right? We're building the coalition and have prepared white papers on all of the topics that you will find at the healthspanactioncoalition.com, a list of initial topics and subject matter. We are soliciting from our members, remember these are volunteer members, the topics that are important to them. How the coalition can be deployed and all across the array, besides the broad public support that it gives to this and the public awareness, hasn't been determined yet. But there's a new longevity caucus. We work with inside the Beltway with other organizations that have lobbyists related to moving the regulatory needle to get funding, very important federal funding for aging research, but not only for Alzheimer's, to recognize the 7 hallmarks of aging that were first enunciated by Aubrey de Grey and now have been widely adopted and understood. So all of these things are moving together. That's a long-winded way of saying we're looking at everything now, and when the opportunity arises, then we are going to be prepared to move on this, including in the World Health Organization, the United Nations, and beyond. Well, maybe when you say beyond, what am I talking about? Space technology. There was a good reason we had a whole morning of space technology here, because all of this applies also to aging and health span. It's huge. I wish I was a student now. I only wish I was a student. I mean, I'm telling you, the tools that are there and the converging technologies and the AI, 50 years from now, the world is going to be completely different. Hopefully it's not going to be dystopian, but it'll be utopian, all right? That's going to depend on your generation. You got to get these old people off the stage. Of course, I'm going to be around, hopefully, because of Aubrey, and, you know, so I won't be able to retire. All right, that's,
Bernie,
yes.
I just want to make a quick comment and then have you add to it. But since this is a panel on patient advocacy, and given Elias's really good question about, you know, we've built this coalition thus far, although I know you and I have big plans to at least double that in the next few months now that we don't have a conference to plan. But just similar to the work of a scientist, the work of an advocate is never done. And I want to use Prop 71 and what happened in the early years of CIRM as an example of that. And another part of it is that as much as you as an advocacy organization or as an advocate may have a specific agenda, the world has a way of deciding for you what you actually will have to do in your advocacy work. So what happened to us in the very early days of forming CIRM is, as we expected, we were sued. So we got this statewide ballot initiative passed. We got 59% of the vote, which may not sound like a lot. I mean, it's a D, right? However, it's huge for getting a ballot initiative passed. You need 50% of who voted plus one person. That's what you need, and we got 59%. If you look at the history of ballot initiatives, it's a very large margin to have achieved. This was in 2004. But we knew that the battle wouldn't necessarily be over, and it wasn't. We were sued, and if you followed the money, we were being sued by the religious right. And while they were not able to completely shut down what has become CIRM, you know, a $20+ billion juggernaut driven by about 15 billion, of state funds, actually a multi-billion dollar juggernaut when you take it all the way out through its paces into industry. But they didn't shut it down, but they held it up. They held it up for a couple of years in the court system. We prevailed, ultimately, at the district court, the appellate court, and the Supreme Court in California wouldn't even hear it. Similar to the amicus brief you filed, we had to file one also. So as the advocates that worked on the campaign, Evan was around at this time and had worked tirelessly to get Prop 71 passed. We had to have a group of scientists and advocacy organizations sign an amicus brief that went to the Supreme Court so that they wouldn't hear the case. So it wasn't until more than 2 years after we got Prop 71 passed that the first bonds, you heard it was a bond initiative, were actually sold. And the reason for that was because the state of California wasn't going to give bond funding to an agency that may cease to exist if the legal case, if the plaintiffs had prevailed. And so the advocates that had already worked so hard to get a ballot initiative passed had another 2 years of work to do on behalf of this nascent agency, which now, I don't know if you've heard of it or not, but if you're in the regenerative medicine space, it's probably something that you're familiar with. And again, it's billions of dollars of state funding that have been necessary and have driven this field forward. But the work of the advocates, it's just never done. And then we had to do it again. I'm looking at Adrian, one of our strongest patient ambassadors for Prop 14 in 2020. The work of the advocate is never done, and whatever you think your agenda is, the world might have another idea for you.